Good afternoon, everyone. Thank you for being with us again, or thank you for being here. If this is your first time listening to our community forum, we always have a good time getting to know somebody very special, working on issues that we care about at CDU. As it was said, I work with Dr. Carlisle, the president of CDU, on community affairs to try to stay connected. We don't want to just stay inside the university. We want to be connected outside as well. We are very fortunate today to have Deputy Mayor Karren Lane of Los Angeles, Deputy Mayor of Community Safety. Karren Lane is an experienced program director who's worked at organizations like the California Wellness Foundation and the Weingart Foundation. She has a background in grant making and policy development, and she's focused on such things as youth organizing, leaders of color, economic inclusion in various counties in California, not just LA. Thank you for joining us, Madam Deputy Mayor. I have some questions to get our conversation started. Time allowing, we will take questions from the audience before we wrap up. Attendees, remember, you can ask questions in the chat or tweet them with the hashtag CDU Community Forum. So let's begin. May I call you Karren or Deputy Mayor? Why don't I call you Deputy Mayor? I want everyone to know your title. We're so delighted that you're joining our wonderful mayor in this enterprise. We're so proud of you both. It's such a new day. It's such a new day, not only to have women of color, but to have young women who've been involved in community and who can bring that knowledge and experience to bear from the mayor's office, which I think our public doesn't really know very well. So hopefully in this conversation, we can help them get to know the mayor's office and your powers a little better. Your title give us your title.
So my title is Deputy Mayor of Community Safety. First, I just want to thank you all for the invitation to be here, to have this conversation. Charles Drew University has been a part of my life as a young person growing up in Gardena, California. I was first exposed to the campus, I'm really going to age myself, but through Young Black Scholars. They used to host the Saturday kind of convenings at the campus. This was many, many years ago. And so that was helpful for me because it was important for me to be able to see a campus environment and really help me set goals on going to higher education. And certainly just understanding the impact that you've all had and ensuring that people of color have access to the medical profession and the healthcare profession. And so just grateful to be a part of this conversation today.
Well, I wish it were as simple as exposing our young people to health and medical education, but we have so many more challenges today. And you and Karren are working on some of those challenges, and we're going to talk about that today. How do you define community safety? What factors do you consider in developing strategies to improve it? It sounds like policing, but it's not the way you're defining it. Is that right?
Yes, that's right. Mayor Bass started a nonprofit in South Central Los Angeles during the height of the crack cocaine epidemic. And with that, really saw mass incarceration, also saw a lot of separation of families. And so for decades, she's been wanting to work with community and has worked with community to address the root causes of community harm. And from, in the early 90s, understood that we cannot just arrest our way out of community harm and crime and violence. And so throughout her career, the mayor has worked to both move policy and resources to really strengthen communities' ability to keep communities safe. And so when she became mayor, she understood that, yes, we need an effective police department, an effective fire department, emergency management. We need effective departments in the city. That's a part of our public safety system. But what she also understands, I think most people on this call will agree, is that our public safety system also includes everyday people who are working sometimes in nonprofit organizations, other times not, to keep that to build the actual social safety net in our communities. And so she thought it was very important that that there be leadership to help provide the city's infrastructure and engagement with community leaders that were actually facilitating community-based safety strategies in the community. And just one last note, someone that I worked really closely with, Joe Paul, he's a faith leader and does a lot of work around reentry in South Los Angeles. He told me, he said, you know, the root word of peace really means completeness and wholeness. And he says, he reminded me that to be at peace doesn't mean you don't have strife, but that you have what you need to get through strife. And that really resonated with me because I think that's my role, Ms. Drew Ivie, is community safety is about ensuring that communities have what they need to prevent crime and community harm, but also to respond to that harm and crisis in a way that doesn't further destabilize that community, but instead repairs that harm and brings that community back to a place of wholeness and being complete.
That's an unusual definition for a mayoral agenda, I think. Am I hearing that as something rather fresh and original, and trying to build a partnership with community in a special new way that's not unusual for a person with Karren's background with community and what she did with Community Coalition? Maybe both of you are bringing that to bear in a structured governance office, which is pretty exciting.
It is. I think, you know, it is new, it is different. I think, you know, community in the last 5 to 10 years, in particular around George Floyd's unfortunate murder, really has created the political condition that's been because there's an external force, I think, on government to think differently about safety. It has created the political conditions and political will across this city and cities across the nation to do more than just collect programs. And so the mayor is intentional about setting up an office of community safety that once again is not, you know, we've always, Los Angeles included, has always had, you know, some investment in community-based safety strategies. What Mayor Bass is doing in this period that I think is unique and hasn't been done in many other places. There's a few other cities that are developing community safety departments and community safety offices, is that she's actually establishing an office with infrastructure. I'm a part of the senior leadership team. In her first budget of her first year, she's fought for significant investments in social services, health services, which is unlike the first in the city's history. She fought for $250 million just to provide for housing and homeless services. She's established in her first budget close to $50 million just to stand up the Office of Community Safety. And so in that way, it is very different in that we are trying to build sustainable infrastructure to maintain these efforts and these strategies.
The mayor's office involving itself in health is unusual, isn't it?
It is. And it did not go without lots of questions and some pushback. I mean, we do applaud that our city council did approve the budget, but there is a school of thought that, you know, the city does its thing and the county provides all the health and mental health services and housing. And we believe that they should. I mean, LA, the city of LA is the largest city in the county. But our mayor is taking the position that the city also has to take some responsibility, and we need those services to be nimble and be able to respond to the crises that we're in. And so it is once again groundbreaking, and it did not go unnoticed that she felt very strongly that that we need to have those resources at our disposal. And we couldn't wait for the county. We are partnering with the county and the state to increase the amount of health services in the city of Los Angeles, but that she thought it was very important that we be able to execute services as needed in order to address the crisis.
You are working with people that you term interventionists. Can you tell us what interventionists do? What are their responsibilities?
So we, the city of Los Angeles has had the GRID program, the Gang Reduction and Violence and Youth Development program since 2007. But even before we established the city's infrastructure to support violence intervention, there were everyday people in communities, community leaders that were working to disrupt cycles of violence, in particular in gang culture, retaliatory killings, just community violence. And the city, you know, under Mayor Vergosa, said this is a part of our public safety system. Everyday people with deep relationships in communities that have both the trust and the reputation to influence the cycles of violence or the risk of violence in local neighborhoods and at the neighborhood level. And so community leaders. And so what we're doing is we're revitalizing the GRID program, but we're also thinking, you know, because of the success of community intervention workers in the city of Los Angeles and the county, gang violence is actually significantly down. In the first 2 years of the GRID program, retaliatory homicides and gun violence actually went down by 97%.
Wow.
in the areas where we had this intervention.
Wow.
And so we've continued to maintain, interventionists have continued to maintain low levels of homicides and serious violent crime in partnership and in coordination with law enforcement. And again, that echoes how the mayor is approaching and trying to build a comprehensive approach. We need both great law enforcement officers, but we also need to make sure community intervention workers have the resources and support that they need to do the vital work in communities. And so we're continuing another thing that the mayor did in her first budget, where these are folks who work 24 hours a day, provide services, really help people realize their own power, to take control of their life and actually to be shepherds of their own community. They're doing that work constantly. They're supporting families after serious crimes. They're providing healing circles in communities. They're disrupting young people from getting involved in violent and harmful activities. And these folks were barely being paid a living wage. And the mayor took the position that these folks are just as important as our LAPD officers, as our paramedics. We need to ensure that they have a thriving wage in the city. And so in her first budget, she proposed to increase the salaries for community intervention workers that were working at an average of $40,000 to an entry level at $60,000. And so while it's not enough, we thought it was a substantial raise that could have a material difference in these folks' lives who are, you know, older men and women who are doing this work. And so that's the importance, I think, of community intervention workers to our safety and our community safety strategies.
And in terms of the org chart, who do they report to? Who do interventionists report to?
So this is the unique thing about the city of Los Angeles. We have taken the position that nonprofit organizations make up the social safety net in local communities. And so what we do, instead of just hiring individuals to perform that work, we contract with nonprofit organizations that have deep roots in the neighborhoods that they serve, have reputation and trusted messengers. And so we contract with about 35 nonprofit organizations across the city of Los Angeles. Through those contracts, we employ about 400 community intervention workers and case managers. Many of these folks, if not the majority, are folks with lived experience. Many are formerly incarcerated, have been victims of crime, have been victims and survivors of violent crime, and they have done that healing work that is so important, so that now they're actually a vehicle for others to actually, again, just being tools of peace and bringing wholeness to communities.
So is this an innovation of your administration?
So what grant has existed since 2007. What we are trying to do is revitalize community intervention workers, because they're working in their neighborhoods where they live, are going to continue to do the work. What we're doing differently in this administration is we're trying to uplift and amplify their voices, their experience, and their leadership in the public safety system, so that we can influence policy and budget decisions in the city of Los Angeles. And again, we're also trying to be a better partner. So what we're doing in the community office of community safety is, one, we wanted to look at salaries, wanted to make sure we're compensating these individuals for the contributions that they make. And then we're also, building out our community safety strategies. So there's violence intervention and prevention, but we also know reentry services are incredibly important to preventing crime. And so we're really blowing out our investments and reentry services for both adults as well as juveniles. The Office of Community Safety will also house our diversion efforts. So we're trying to prevent young people from going into the criminal justice system. So we're trying to partner with LAPD, so pre-arrest diversion programs. And then we're trying to actually give all of those folks who do reentry, diversion, violence intervention to increase their toolbox. So we're starting to go increase our training around trauma-informed care, healing practices, hospital-based intervention and services. So how do we actually support families and individuals in the hospital setting who have just experienced trauma? So we're trying to also increase the capacity of community safety workers to be able to make the impact that they want to make.
So it's really, it's kind of a health mindset. It's a healing,
Absolutely.
It's a community healing mindset. And these are the components using members of the community.
Absolutely.
It sounds wonderful. Sounds really, really wonderfully innovative. The people of LA have happily elected Mayor Karren Bass. What can the people of Los Angeles do now that we've elected her to support and advance the agenda that she's running? What can we do?
Oh, that's a great question. I think, and the mayor would agree with this, is the power of organized political power. And, an example, and I won't be long-winded, but I think it really exemplifies what I mean. So the mayor heard the demand from community intervention workers about their salary. And so she answered that demand, but that wasn't quite enough. The mayor makes a budget, and that proposal has to then be approved by city council. And so one of a guest that was participated in one of your community forums just a few months ago, the Urban Peace Institute, serves as an organizing body. So they bring together all of those agencies that I referenced that the city contracts with to provide these services. They actually bring them together as a body. Mm-hmm. And it was their organizing bringing their individual political power together as a collective, that, and then getting these same folks who have had, negative experiences with the system, working in neighborhoods where there hasn't been the government accountability, like you would see in more affluent parts of our city, organizing their voices to participate in the budget process. So for 4 to 6 weeks, and it brought me to tears at certain points, because there was one young man, he came and spoke at the first budget hearing, and he stuttered and he couldn't get his point across as strongly. The second time he got stronger. The third time he was really standing in his power. And it was because of that organized effort, city council members today approved the increase in those salaries for those CIWs. Now the mayor wanted to do it. It was in her proposal. But it took the organized political power to, one, hold the mayor accountable to her promise and her commitment, but also to ensure that those in power exercise their power to the benefit of not only just these individuals for salaries, but for their community. And, Ms. Drew Ivie, it was beautiful. Even the young people that these agencies served came out. And a young woman from Brotherhood Crusade, she gave her personal testimony, a 13, 14-year-old young woman who said, this agency creates a safe space for me to be innovative and creative. And she finished her talking point by saying, now I need you to give my case manager the ability to be innovative and creative so that she can better serve me. And that's what everyday people can do. It's holding government accountable. It's participating when you can. I mean, there's volunteer opportunities. As we talk about cleaning up homeless encampments, what we would love for people to do is, in your community, just don't tell us about the encampment, but after the encampment is cleaned up, what do we do in those moments to beautify and restore those areas, right? How do we, when we clean up the encampments, folks often go to motels and other living arrangements. We would love to have welcoming kits available for those who are being rehoused. So I think it's both staying involved, staying activated, participating, using your voice to hold the city accountable and to demand accountability, but also to use your influence in your peer group and your family to create volunteer opportunities to be a part of the change.
And you're relying on the community agency as the intermediary, because you don't have the person power in your office, I assume, to manage all the things that you're describing that these young people are now encouraged to be involved in and to become leaders in. But you work through the community organization. Is that the way it works?
For many of our efforts, yes. So we've the tax dollars are being put back into the community through contracting and partnerships with community-based organizations to do that work, to create spaces for activism, spaces for service, for those to serve and to be served.
I'm sure that for many of the young people that you're working with, the concept of participatory governance is a new idea. That's very exciting, because I don't think they've been invited to be participants in this way before. This sounds quite new to me, and very empowering, not only to the young people, but to the local agencies, because the local agencies need help to bridge those young people and to help pay them and keep the collaboration going.
Absolutely. I think a lot of nonprofits and one of some of the work that I've done both as a grant maker and as a community organizer has been with working with nonprofits. And oftentimes I think 501c3s and nonprofits have a fear of, if we complain too much, we'll lose our contract. And, I think one of the things that I have done in my role, and I think this is the mayor's approach, is, the mayor's also, comes from community organizing. Yes. And I think even those on this call would agree that even in their work, relationships matter. And you can't skirt that. You can't get around with having relationships. And I think that I've leveraged building relationships and trust with our community partners to hear their feedback. Okay, what's not working? You know, how can the city be a better partner? You know, the other thing that we're doing as part of the first year of the administration, we're not just inviting you, we're creating actual opportunities for folks to participate in the development of a blueprint for community safety for the city of Los Angeles. And over the next 9 months, we are going to host listening sessions throughout the entire city of Los Angeles. We're also going to do both polling and surveys through to reach as many residents as we can, to get their thoughts about their current perceptions of safety in their neighborhood and what they think would make them feel safer and be safer in their neighborhood. And we're going to use that to develop a blueprint for community safety that will inform the administration's budget process and policy making. And so again, we believe if you're part of developing the solutions, you will take ownership of that solution and you will ensure that solution is actually activated. And so, you know, we hope Charles Drew will be a part and possibly even host a listening session. But so we really are trying to create opportunities, for folks to get involved and to raise their voices and to have an ability to influence how the city is governed.
Are these constituents young people who vote?
We hope to. So we obviously, it's always easier when you're trying to get across the city to look at voters lists. So we are going to look at voter lists, but we're also going to engage with youth organizing groups that are, there's the city of Los Angeles is blessed to have youth-led and youth-serving organizations that have really worked to increase civic participation among young people. And what we know, and it's been documented, is that when young people are activated, when they're politicized, one, they stay in social justice work longer, they stay civically engaged longer, but they also influence and increase civic participation in their families and in their neighborhoods. And we find this to be true, the research finds this to be true, even in communities where there's mixed status. Young people are a vehicle to really increase civic participation. And so we want to galvanize that energy and get the input from young people, whether they're voting age or voting eligible or not, because they should also have a voice in how the city is governed.
At least it provides a platform for you to discuss that, because
absolutely,
in my experience, young people feel that voting doesn't touch their lives. Is something irrelevant to how they live and the problems that they are trying to solve. But this is a wonderful bridge to discuss how their vote can actually become the source of greater relevance.
Yes.
In the people that they're electing. This is a question that came in from a listener. I love the idea about diversion programs. How do you see workforce development playing a role in diversion programs?
Absolutely. So right now, what we have, the city of Los Angeles, we have, and one of the things the mayor wants to do is to make sure that the city gets as many grant dollars from the state and the federal government as possible. And so we are, pursuing, President Biden has put a lot in his budget for job development and reentry. And so we have 2 programs in the city. One is with the Caltrans. And so we provide we work with, once again, nonprofit organizations to identify individuals to have temporary employment as a way to transition them into long-term employment. We also have a work program under Prop 47. So Prop 47 helped decriminalize petty theft and drug possession crimes and put those dollars, those savings into treatment, prevention, treatment, and job development. And so we have that program in the city. So we're looking for folks to give them comprehensive and wraparound services. So how can we help them expunge their records, as well as find and identify employment, and access other like mental health services. So we're doing that work through the Office of Community Safety. And then the other thing that the mayor and the administration is working on is there are we get the quote off, but there's up to about 3,000 to 5,000 city job vacancies right now in the city of Los Angeles. And these are jobs that one, we need to fill because they're vital. Those positions are vital to city services such as sanitation and all the things you see going wrong in your neighborhood. It's because we're not fully staffed in the city. And so we are working to develop a strategy, what I'm calling a city job campaign, of how do we actually create pipelines into city jobs for those who are have had difficulty finding employment or who have been separated from employment, either for a variety of reasons. And so we are working to make those connections as part of our reentry and diversion efforts.
That sounds like things that were done in the 1960s. You're not old enough to remember that, but that is exciting. That is something that was done during that period with great efficacy, really finding jobs for young people. From a faculty member, how do you relate to the Deputy Mayor for Public Safety, Brandon Williams? What is the division between your responsibilities?
So we are two peas in a pod. We work very closely together because, again, the mayor's vision is a comprehensive approach to safety. And so my colleague, Brian Williams, he works to, again, increase both accountability and efficacy in the department of LAPD's department, fire and emergency management. And I'm working on what you could consider civilian community-led safety efforts, but you need both to work. So, the grid example that I gave, it really depends on some cooperation with law enforcement. So the gang units in LAPD, there are agreements of how they work with our community intervention workers, right? And so we work together to ensure that partnership works. We also work together around answering questions around Metro, for example. So myself, Mr. Williams, as well as my colleague, Deputy Mayor Randall Winston, we are working together to think through safety on the trains and how we do that. So one of the things that the mayor and was very clear with her leadership team is that we work across silo. We're not going to be siloed. That if we're working in silos, we're not serving community. And so we really look for comprehensive integrated approaches to the issues that we're trying to impact and the solutions we're trying to win.
How many deputy mayors are there? Do you know?
There are 11 of us, 11 deputy mayors.
Okay. When this is over, if you would send me a list of the deputy mayors, I think that's something we'd like our students to be aware of, just, the organizational chart of what happens in the mayor's office. We're elated about Karren, but what happens the next tier down?
Absolutely. And one quick note, in addition to our deputy mayors, the mayor is also, and I don't hope I haven't missed the train. I think they're either looking or they're securing a physician to come on board as a part of the leadership team to help us identify strategies to actually connect health and health care to our housing and our homeless work, but also across all of our issue areas. And so, Mayor Bass comes from the health field. And so she's bringing all of her tools to bear to really address this crisis in our city.
Take that, LA County. You can't have the whole cake. Another question from a viewer. We also know that education is a social determinant of health. What can a university like CDU do to partner with the mayor's office regarding workforce development, especially since our programs are in the field of health?
Absolutely. It's one that I could brainstorm with you all, but I would love for us to think about concretely how we might be able to have a focus group with your faculty and some of your students around how we can do it concretely. So I think, theoretically, what I know to be true is, just as I mentioned, the unhoused work and focusing on encampments, these are folks who may or may not have had any health services for many years, right? We know that there's 2 to 3 people that die on the streets in Los Angeles every night. And so we know that there are some real health complications. That's obvious to us around being unhoused. That's going to be a bigger risk as temperatures rise in the city. So we do know that we need to actually integrate health approaches and working with our unhoused populations. The other thing that we're building in the city of Los Angeles is, and it's called a couple different things, but we're building an alternate response system. And so who's the better appropriate responder to someone who calls and says, my son is off his medication, I'm concerned about him. What we have seen is that when armed police officers respond, it both puts the officer as well as the family in a higher degree of risk of harm. We know that to be true. And so what we're developing in the city is how do we divert those types of health crisis calls to the appropriate responder. And so we have a crisis across the nation. We don't have enough licensed clinicians to build an alternate workforce to do that, to house and staff that type of approach. And so again, I think there's opportunities for us to talk with Charles Drew of, how do we create whether it be a paraprofessional or some type of training, a position, a training and certification, so that we have folks who want to provide those services in community. Maybe they have lived experience, maybe they don't, but could be a more appropriate response than an armed officer who's not necessarily trained in those ways. And so we have the Circle program where we are diverting hundreds of calls each month for unhoused calls regarding unhoused populations who are being observed experiencing some type of mental health crisis. So we've started to do that in the city. This mayor is interested in actually building out an entire system. So we just don't want to have a bunch of collections of programs. We really want to have a systematic response that reflects a change in approaches to safety. And I think Charles Drew could be an incredible partner as we think through how we actually grow a workforce to play those roles.
Well, we have a lot of highly energetic students who really want to be used and be useful. So please call me if I can be helpful to connect you to any of them.
Absolutely.
Are there any specific measures or programs in place to address the unique safety needs of vulnerable populations, such as the homeless? Karren was on television the other night with housing a large number of homeless people. But those that have mental health challenges are especially difficult.
Yes.
What are the plans around that? I know that you've said that the city is not the primary health provider, the county is the primary health provider, but Karren obviously has been invested in that population. And are there measures going on in your office to deal with that, with the homeless and the mentally ill?
Yeah, so through the Office of Community Safety, as I mentioned, we're growing the program Circle. And so one thing that we're trying to do is to keep that population out of the criminal justice system. So we know that they cannot be served in Twin Towers and being in jail. That's not the solution. So through Circle, what we do is, again, we divert the calls, we deploy a team of a licensed clinician and someone with like a practitioner who's had lived experience. And we're able to actually then take that person, de-escalate if we need to, and then connect them to services. And oftentimes what we find is that these individuals have already been enrolled in services. And so we're trying to effectively reconnect them back to services. And so that's one program that we have that we're trying to grow into a more of a system. And as I mentioned, the challenge is the workforce. You know, we don't have enough people to staff the strategy. And that's a huge challenge. But across the administration, and this is reflected in the mayor's budget, and I think is reflected in how she's building her leadership team, is yes, we know that the city cannot be the primary provider of services. That is the county's role. They're resourced. They can use Medi-Cal, a number of things. And so the mayor is working actively to lock arms with county departments to have shared strategies and place-based strategies. And so she is doing that work with the Department of Mental Health, Department of Public Health at the county level. And then she's also, as I mentioned before, she's trying to access additional services that we can try to supplement those types of services in through the city. So one of the things that we were able to secure this week, and again, the support of the city council, and there were questions, and that's their role, is to ensure that we're moving in a positive direction. We secured dollars for opioids. And again, that's something that the county usually does, but the county right now for drug treatment only provides 90 days of services. And what we know to be true is people oftentimes need more than 90 days. And so when I talk about the city providing services, what we did was secure additional dollars so that individuals can go beyond 90 days and continue their services into sobriety, into housing until they're stable. And so those are the kinds of approaches that we're trying to take, both partnership, piloting new approaches so to keep folks out of the criminal justice system. And then we're also trying to really lock arms with the county and the state to get more services where they're needed.
Well, it sounds very innovative, and I just applaud expanding the role of governance at the mayoral level to address those issues, because oftentimes, isn't it leadership that's needed? It's not just having a hospital, it's not just having a clinic, it's having leadership that says, here's the problem and here's some innovative ways that we can get at the problem. And that's what it seems to me you're describing, that you're coming up with innovative ways to address longstanding health issues in partnership with community. So I think that's very exciting news. You talked about how you might collaborate with the CDU. Are there other educational institutions that create safe learning environments for students in Los Angeles? Is there a partnership there that you might foster so that students can be extended helpers for all these wonderful things that the mayor's office is doing? Students have such energy.
That's right.
And creative ideas.
Absolutely. I think across the city, we are trying to both identify, and there's a lot of great things that were happening at the city under Mayor Garcetti's administration that were helpful and help bring to create opportunities for participation. This administration really wants to grow those things and create space for both young people, students, to really participate in governance. And so, through my office, we and this year we might have missed the opportunity for this audience, but we have summer night lights every summer. And this is it's more than just, we do a lot of activities at the park and the housing developments. It's a built environment strategy. And research shows that when you fill public spaces with family activities, youth activities, and you couple that with youth job opportunities as well as community intervention, you actually decrease crime and serious violent crime. We've been able to do that consistently every summer. But those are spaces where people are coming together. And so how wonderful would it be to have not just health fairs where we're giving information, but can we use that as an opportunity where we're doing not only health education, but can we do health exams in those spaces? I mean, we are at both Jordan Downs, Imperial Courts, and Nickerson Gardens this year. We are partnering with small businesses in the area to provide food. So it's really neighborhoods, taking care of neighborhoods and taking ownership of these public spaces. We employ over 400 young people during the summer to provide those opportunities. So again, we're seeing this as not only a safety strategy, but it's an opportunity to plug in. And another thing that we're doing in the housing developments is that job fair, that job pipeline that I discussed. So all of the young people who work for us become city employees. They go through the city employee hiring process. And so we're going to have a job hiring fair that when this is over with, are you interested in any of these open jobs, right? And connecting jobs. And so that's a real, very low hanging fruit, but point of opportunity. We would love to talk to Charles Drew. Are there activities that a cohort of students would like to do on a weekly basis with the young people who are there, whether it be, around reproductive health or, a number of things that I think that Charles Drew could come up with? We would welcome it. And we're at not only the housing developments, but we're at 41 other sites across the city. And so if you're not in the LA, the South LA area, if you live in the Valley, we would love to have young people be a part of that and students to be a part of that. And we're trying to fill the parts. So that's just something we do every summer that we could plan with together and be able to implement for next summer. And Fall Fridays is another. We do Fall Fridays through November. So back to school, health checks. I mean, all of that is some real opportunities for us to work together.
No, it sounds great. We have also a mobile health outreach program. We could partner with you to go out with our mobile health outreach where you're doing community programs, so that right there students could come in, community members could come in, get health education, get shots, whatever is going on that the community needs at that time.
Absolutely.
We'd be delighted to do that. So we get a call from Brian asking, what role does public-private partnership play in addressing community safety, and how do you foster collaboration between different sectors? I think you've addressed that earlier on in terms of how you're working with the young people. Looking ahead, what is your vision for community safety and empowerment in Los Angeles? What is your vision? You've described the things you're doing, but what is the overarching goal of using the mayor's office to make us all feel safer in our communities?
And I think it connects just to that word filling. So I think community safety is one of a perception. Mm-hmm. And then there's obviously, crime statistics, right? Are we actually reducing the incidences of crime? And we are going to measure that. But what success, I think, looks like for this administration around community safety is changing the perception of what it means to be safe. And I think that that's going to take that work of one, asking people what makes you feel safe and what would make you feel safer, and being able to then garner the city services that are necessary to fulfill those needs and those, what has been identified. Because what makes, a neighborhood in South LA feel safer is going to look different than in the Valley and in East LA and Boyle Heights and West Los Angeles. And so we want to have really responsive strategies to deal with safety. But I think, if I had to use more of a visionary statement, I think the perception we would like people to have the perception that they have the tools to keep their neighborhood safe. And we have, policing that is that repairs harm and doesn't do harm. And we have the tools in our community to prevent crime and prevent harm. Because what we do know is when people feel connected to their neighborhoods, to their schools, that they have an increased sense of safety. And so I think I know that that's what this administration is committed to. All of that equals government accountability. And we want to ensure that City Hall is accountable to every neighborhood and every community, and every community has the services and support that they need from their local government to once again feel whole and to feel complete. And we believe that that will make people feel more safe in their communities.
Well, you've described a connectivity for communities that I think is very unusual, rare even, to have a sense that you could be a resident of South LA and be connected to what happens in City Hall.
That's right.
And to the programs that you've described with such clarity today is just so encouraging, and makes me feel so grateful for this new administration, and that she reached out for you with your experience with the foundations funding these kinds of community efforts. It's just very, very positive and very hopeful. Is there anything else that you'd like to share with us before we close out? This has really been so instructive, and I wish we could have you every week to talk about what's happening in the mayor's office, because it's so encouraging. It just makes me feel we did something really right. We got the right people in there, and they're really helping us. They're really helping us in our communities. Is there anything you want to close out with?
Well, just would love to hear from folks in follow-up. If we would love to engage directly, if there's a focus group that we can just really sit and brainstorm ways to connect the university to some of these efforts, I would just love to follow up with all of you around that. Also, I would love to send you all information around summer night lights. If there is, I know it's summertime and, not maybe having the time to plan, but if there's even one pop-up day that you all would like to do at one of the local sites, we would love that. But just, and as well as the community blueprints, the blueprint for community safety. So I would just love to stay in community with you all. And, you all know how to reach me. We try to be incredibly accessible. If there's ideas or thoughts that you all have, or even, things happening around the university. I mean, one of the things that I was happy to be a part of when I was in philanthropy is really supporting the growth of Charles Drew and wanting to make sure and see.
Thank you.
But wanting to see that, that space was safe for young people and the students to thrive and to learn. And just so, again, we want to be accountable to all of you. If there's ways that we can be supportive of making the built environment for students in that campus life, for folks to feel safe there, would love to just know that you all can reach out to me directly, and we'll do our part to be responsive along with the council member.
Well, I know that the president would love to have you come and talk with his seminar. He has a seminar with students from all three of our schools: the nursing school, the School of Public Health and Health Science, and the medical school, just so that they could get a feel for how government can be integrated in the aspiration for better health and healing for communities in need.
Absolutely.
We haven't had an opportunity really before to talk with anyone from the mayor's office about these issues with so much specificity. So it's so nice of you to give us this time today and to express your interest in possibly working in some way with us. So I just want to thank you for your time and for the work that you're doing. And please tell Karren that she's done a very fine job.
Absolutely.
In selecting you as a helper in her large agenda.
Thank you. I appreciate that. I appreciate all the work that you all do. And I would love to come out. I'll bring my colleagues who do both the housing work and the home unhoused work. So I can bring Brian Williams, whoever you all want, we can all come and have a great conversation. I would really appreciate that and look forward to it.
Well, look forward to it. You will hear back from me.
Absolutely.
Thank
you so
Karren.
much.
Thank you.
Bye-bye.
Thank you, everybody, for attending. And we'll see you in, I think in 2 weeks. I'm not sure. Jackie will tell me I didn't get it right, but look for the next announcement of a community forum. We love this opportunity to bring in people like Karren to keep us informed and educate us about what is possible to do in a structured governmental entity to help the community that we're trying to work to serve in medical care. So good night, everybody, and have a good evening.